Guys, welcome back. And after a long gap, again we are going to discuss something about nursing diagnosis. Okay, in one of my previous video, we had a discussion regarding Nanda diagnosis. North American Nursing Diagnosis Associations are the base of nursing diagnosis. So we have to follow Nanda nursing diagnosis formulas and platforms while writing a nursing care plan. And we had a discussion regarding what is two-way, three-way nursing diagnosis and etc. And I'll add the link of that video along with this video, so you can see the basics of nursing diagnosis development and all those things are in that video. And in this video, we will see a care plan, how to write a care plan with the support of a nursing diagnosis. So we are going to talk about acute pain. Okay, so if the patient is suffering with acute pain, how you will develop a nursing diagnosis based on Nanda nursing diagnosis, and how we will write a care plan for that nursing diagnosis. Okay guys, so pain is a common nursing diagnosis we will see everywhere. Okay, so if you get an examination paper, means definitely one of the major symptoms we could find out in your patient is pain. So this is one of the very important nursing diagnosis, and if you go through this nursing diagnosis and care plans, it will be easy for you to write. Okay, so acute pain. So what is the reason behind this pain? Means most probably some trauma or any kind of surgical intervention or any kind of cut or wound, right? So you can write the diagnosis like acute pain related to tissue trauma or surgical interventions, as evidenced by verbal reports of pain, facial grimacing, and increased heart rate. So acute pain related to what? As I said, trauma, might be any cut or injury or surgical intervention. Okay, so just check what's the condition of your patient. If the patient is having some tissue trauma, you can write acute pain related to tissue trauma as evidenced by verbal report of the patient. Okay, patient will complain like, I have pain in this so and so area. So you can write acute pain related to tissue trauma or surgical intervention. If there is any surgeries you could see in the patient's body, means you can write surgical intervention. So acute pain related to tissue trauma or surgical intervention. So if there is only surgical interventions, means you can write acute pain related to surgical intervention, or there is only a trauma and minor ward dressing and kind of stuff, means you can write acute pain related to tissue trauma. Okay, no need of writing surgical intervention. So acute pain related to tissue trauma or surgical interventions as evidenced by what? It is evidenced by what? Verbal report of pain. So this is a three-layer nursing diagnosis. So here you can see the reason, etiology, and the evidence, right? Acute pain, okay, symptoms. Okay, then etiology might be surgical intervention or trauma, that depends upon your patient. And you can also see the report evidenced by verbal report of pain and facial grimacing. Sometimes the patient's face will be very dull. Okay, and increased heart rate. So obviously when the patient is telling about pain, definitely you have to check the vital signs. So you can write if there is an increased heart rate, definitely you can write that. If there is normal heart rate, no need of mentioning that one. So again, I'm telling, if somebody is asking, or if your evaluator is asking about writing a care plan on acute pain, first you have to formulate the diagnosis. The diagnosis might be acute pain related to tissue trauma as evidenced by verbal reports of pain, facial grimacing, and increased heart rate, or acute pain related to surgical interventions as evidenced by verbal reports of pain, facial changes, and increased heart rate. Then, while coming to the goal, what would be the goal of this care plan? Means the patient's pains will be effectively managed to improve comfort and overall well-being. So what could be the goal? Means what is our goal? So why we are planning a nursing care plan means to reduce the pain. So always write your goal in future tense. The, so will be, okay, that word will be, shall be, would be. So kind of words you have to write while writing your goal. So the patient's pain will be effectively managed to improve comfort and overall well-being of patients. So this is the nursing diagnosis and care plan. Guys, you have to write like this. Okay, evidenced by, that word is important, acute pain, then related to, that is important. So that connecting words are important in nursing diagnosis. Acute pain related to tissue trauma or surgical intervention as evidenced by verbal reports of pain. And while coming to the goal, write your goal in future tense. The patient's pain will be effectively managed to improve comfort and overall well-being. And this is the major part of your examination might be write the nursing care plan. So based on your symptoms, based on the symptoms of your patients and problems of your patient, you have to plan your care plan. Okay, so this is a general care plan and you can use in almost all what pain conditions. So while writing a care plan, you all know that there will be some sessions. Okay, assessment, diagnosis, planning, rational, implementation, evaluation. So make the column like this: assessment, diagnosis, planning, rational, implementation, and evaluation. So under assessment, two things we have to write, that is subjective data and objective data. What is subjective data means what the patient says about the condition, that is called subjective data. And what is objective data means what you are observing as a nurse or healthcare professional. So in subjective data, imagine the patient says that she or he has pain in the left leg. In objective data, what you're observing, the nurse observed that the patient looks dull and tired. Always you have to write in the second person's form. Okay, don't write like I observe that the patient looks dull, faint, tired, like that. Don't write. The nurse observed that the pain looks. Don't write in a first person's view. Okay. While writing subjective data also, the patient says that she or he has pain. Okay. Don't write the patient saying that I am having pain. Don't write that. You have to write the patient says that she or he has pain. Then in objective data, the nurse observed that patient looks, not I have observed. Okay, because this care plan will be followed by some other person, so they will understand to their understanding. You have to write in second person's view. The patient says that she or he has pain in the left leg, that is subjective data. So what is subjective data? What the patient says about their condition, that is subjective data. And objective data means what is your observation, that means the nurse's observation. Then diagnosis, the same diagnosis you can repeat here: acute pain related to tissue trauma or surgical intervention, as evidenced by verbal reports of pain, facial grimacing, and increased heart rate. Guys, no need of writing all these things. Depend upon the condition of your patient, you have to say. Might be there is normal heart rate, means no need a specific like increased heart rate. Then goal. The patient's pain will be effectively managed to improve the comfort and overall well-being. So patient's pain will be effectively managed to improve the comfort. In future tense you have to write. So that is the second column. After that, you can start your nursing care plan. So whenever you start writing your nursing care plan, don't forget to write history collection and physical examination. So that is the first plan. So do history collection. Without rapport, without communicating your patient, you cannot do anything. So whatever care plan you are writing, please start your care plans planning with history collection and physical examination. So that is the first thing. Okay, do history collection and physical examination. That is the first point. So what is the rationale behind this planning means to understand the condition of the patient. And in implementation column, you have to write completed physical examination and history collection. So after doing that, you have to write completed physical. So that will be in future, I mean like past tense. Okay, completed, you completed it, so completed. So planning will be in present tense. Okay, implementation will be in past tense. So do, that is in present, completed, past, you are finished. Then provide pain management techniques like distraction relaxation techniques, that is another plan, that is a general plan. Then for what you are doing, that means to reduce the severity of pain and also to divert the mind of the patient. And while coming to the implementation, again provide changed into provided no pharmacological pain management techniques like relaxation, music, art therapy, whatever. Then encourage the patient to report pain promptly to allow for timely intervention. So that is another plan. Then for what you're doing, that means to check the severity of the pain. Then patient reported pain and marked in the pain checking scale, or whatever is there you can write in that, or just you can write patient reported the pain. As soon as he or she felt pain, or he or she uh, experienced pain. Okay, then administer analgesics as per the doctor's order and give wound care. Okay, if there is a surgical intervention, there will definitely you have to give wound care. Wound care and dressing will give some relaxation. Okay, then analgesics as per the doctor's order. Okay, if you are a nurse, definitely you have to write administer analgesics as per the doctor's order. For what it is doing means to reduce the pain, and administer paracetamol, and you can write the dose. So in planning you have to write in present tense. Okay, in implementation everything you have to write in past tense. Okay, and evaluation also you have completed, so you can write the patient's pain reduced to some extent. Okay, so this is a general care plan. Okay, so wherever if you are writing a care plan related to pain, you can use all these points because I've added only the general points. So you can add all these points and you can make a good care plan. Hope you understand, guys. Thank you.